we'll cover the thoracic cage. Anteriorly and medially, we have the sternum. The sternum is divided into three parts. This is the manubrium, this is the body, and this is the xiphoid process. The xiphoid process is what students typically feel for during CPR to do compressions above. To remember the manubrium, I usually tell students to think about people when they get into fights. Sometimes they bang on their chest and they go, "Come on, man, bring it, man." So what they're beating on is their manubrium. Now, completing the thoracic cage, we have 24 ribs, 12 on each side, regardless if you're male or female. We know these ribs will attach to the thoracic vertebrae posteriorly, but anteriorly, they attach to the sternum. So it'll look something like this. So looking at a rib, the part that attaches to the sternum is the sternal end, while the part that attaches to the vertebra is known as the head. We have a small rounded bony projection here known as a tubercle. This is a term we learned in the terminology mini lecture. A bend in bone is typically an angle, and then the rib has a shaft. You'll also notice a little groove here on the inside of the angle. This is a costal groove where arteries and nerves will run. Now, in addition to being able to identify those parts of a rib, you need to be able to identify rib 1 by itself because it doesn't look like any of the other ribs. It's a very short, compact bone, and oftentimes students get it confused with this bone here known as the hyoid bone. The hyoid bone is the bone you feel in the crook of your neck anteriorly. If you were to stick your hand right there at the crook of your neck and swallow, you would feel the hyoid bone move up and down. This is the last bone of the axial skeleton, and interestingly, it doesn't articulate with any other bones. It's completely surrounded by muscle that help you to manipulate your tongue for speaking and eating.